Hi, I'm Kevin McDonald. I'm here at the Channel Company's Health IT event in Palm Springs, and I just got off stage where I discussed the whole issue between the release of the 2013 Omnibus Rule and some of the changes that it made to high tech. I also talk a little bit about the challenges that people are having in understanding what does HIPAA high tech really mean and what does compliance mean, not just by definition, but in practice. Well, I think is how do you put a regulation that's undocumented or isn't very specific into action. So what we're seeing a lot of is people reading a regulation and thinking, well, how do I make this apply? I don't know which technology to use. I don't know whether or not this actually applies to me. So part of what I do is I help to provide people with some clarity. Yes, it does apply to you in most cases. One of the big things is business associates today. So covered entities have their own entity and they have relationships with people called business associates. Under the new Omnibus Rule, those business associates need to be compliant in the same way that the covered entities do. This is a huge undertaking for an organization that has ignored it for many years in many cases, and it can actually fundamentally change the way you operate. I think focus on the primaries first. So instead of trying to focus on the big picture beyond the risk assessment, start with that risk assessment. If you have not done an entity-wide risk assessment that involves all of the primary divisions of your organization, you're already out of compliance. After that, start with encrypting your data, because the only safe harbor in HIPAA high tech is if your data is encrypted. So by doing that encryption and then moving forward with more of the policies and procedures and the regulatory compliance, you know that you have some safety in the background, that while you're fixing your policies and your reg match, you've already got some semblance of safety with having encryption. Well, I don't know. That's an interesting question. I think under the current administration, they've shown a tendency to continue to ratchet down the regulations. I find it somewhat ironic, considering these are the same people that are building the healthcare.gov website and did nothing for security. But with that said, they've shown a very strong propensity towards patient privacy and security of data, at least on the part of the rest of us. So I would assume we're going to see more penalties, much more strict audits. Business associates are now being audited. So I think we're going to see significant changes there. And I also believe there's an awakening of patients that we haven't recognized yet. Because of the healthcare.gov debacle, many patients now recognize that there's a question about the privacy of their healthcare data. So I think we're going to start to see patients questioning, well, what are your policies? What is your regulation? How do you protect my information? And that's going to change the landscape quite a bit.